This video is to inform patients of what a robotic-assisted radical prostatectomy is, what it involves, and what the patient journey will be when you come for your operation here at Stockport Foundation Trust. So the aim of the operation is to treat prostate cancer, which is localized within the prostate and has not escaped outside. The aim is to remove the whole of the prostate gland with the seminal vesicles, which are the glands next to the prostate. And on occasions, we may also opt to remove the lymph glands, which is the first place where prostate cancer can spread. We then have to suture the bladder and the urethra, which is the water pipe, together to bridge the gap. And we do that over a rubber tube called a urethral catheter. So your operation will be done keyhole, and this will be with the assistance of the Da Vinci robot. This technology has revolutionized prostate cancer surgery. It allows more precise movements and has magnified imaging, which is also 3D. This has meant that compared to the old traditional way of doing an open operation, the outcomes have improved. The length of stay is now far shorter, going from 5 days to 1 day, and the complications are also fewer. We also feel that the functional outcomes in terms of your continence and erectile function are also improved by robotic surgery. Stockport NHS Foundation Trust is a high-volume centre for these types of operations, and we also take referrals from other trusts around the region. There are alternatives to this treatment, and these include external beam radiotherapy, brachytherapy, and hormone treatment, which you will also have an opportunity to discuss. When you come in for the operation, you will be advised to begin doing something called pelvic floor exercises prior to the procedure, and this is to improve your continence. So, what happens when you come into the hospital? You will initially have a pre-operative assessment, which is likely to be a few days or weeks before your operation, and this is to check your fitness for surgery and to go through your medical history and take some blood tests, urine tests, and tracings of your heart, and do any other relevant tests that will need to be necessary to optimize you for surgery. Following that, you'll be given a date for the operation. You'll turn up on the day, normally, depending on what time it is, either 7 o'clock in the morning or 11 o'clock in the morning. You will be seen by the nursing staff on the ward. You will be seen by the anesthetic team, and you will be seen by the surgeons who will go through all the relevant information with you. Prior to this, you will also need to have a COVID swab and a urine sample, which will need to be negative before you proceed. We'll also go through all your medications, and the pharmacist will check all the medications that you're taking. When you're reviewed by the anesthetic doctor, they'll go through a few things with you. They'll explain the medication you will receive, which will put you to sleep, the pain control. They'll check your teeth to see if you've had any previous dental work. During the anesthetic, there is a small risk of damaging the teeth when they put the tube in. They'll also go through with you what medication you'll have after the operation, including pain relief and anti-sickness medication. So the operation will be on the day, and then we expect that you'd be in the hospital for a day. Most patients will go home the following day. We expect that on the first day of the operation, you'll be able to drink fluids about 4 hours after, and then you can have some food later on in the evening. The following day, you will be reviewed by the surgical team. You'll have some blood tests, and then if you're well and we'll get you on your feet, you should be able to go home on the day. We would expect that you're up on your feet and walking around on the first day after the operation. The operation takes approximately 2 to 3 hours. You will be asleep under a general anesthetic. We tilt the bed about 30 degrees head down to allow access to the prostate. You will have 6 wounds in the abdomen, which will be closed with some metal skin clips. You will be fitted with a urethral catheter on a leg bag for 7 to 10 days to aid drainage of urine. Occasionally, we may leave a second tube, something called a pelvic drain, on the side of your abdomen, and that is normally left overnight and then removed the following day. In terms of nutrition, we encourage you to have a healthy, balanced diet leading up to your operation, and if you can lose some weight, that's also beneficial, as well as quitting smoking. When you arrive for your operation, you will need to be fasted for 6 hours prior to the operation of any solid food, and 2 hours for clear fluids. 6 hours also includes things like tea and coffee and chewing gum. After the operation, you will be able to eat your normal diet, and we encourage you, as this will improve your recovery and stimulate your bowel function. In terms of the types of food you can have, high carbohydrate meals before the operation will improve your chances at surgery, and then after the operation, a high protein diet with plenty of vegetables will help improve healing of your tissues after the operation. So what are the risks of this operation? So most of the complications are rare, but you need to be aware of what could potentially happen. So during the operation, there is a risk of bleeding, which may require a blood transfusion on a rare occasion. Even more rare than that, you may have to return to theatre for a second look if that persists. We'll give you some antibiotics during the procedure to reduce the risk of infections. There's other organs around the prostate that could potentially get injured. These are the rectum, the small bowel, and the ureters, which are the pipes that drain urine from your kidneys down to your bladder. If they get injured, we can correct those at the time. Although the procedure is being done keyhole, there's a less than 5% chance that we may have to convert to a traditional open operation where you have a larger wound down the middle of your abdomen. If that happens, your recovery will be slightly longer, with a slightly longer stay in the hospital. Where we do the stitching and suturing, there's a small risk of leaking urine. If we remove lymph nodes, there's a small risk of a lymphocele, which is a collection of fluid in the pelvis. If this happens, we may have to perform a minor procedure to correct this. The operation can affect your function in a couple of ways. It can affect your continence, and it can affect your erectile function. Initially, you may have to wear pads to control your bladder, but this should get better with time, and most men will be continent at about 12 months. 95% of men will be dry, and 5% of men may still have incontinence, which may require further treatment. Where we make the small incisions, there's a small risk of hernias, and there's also a risk of developing blood clots, so we will provide you with some injections to take home to reduce that risk, and that's for about 28 days. One of the consequences of surgery is that it may affect your erectile function. This is because the nerves that provide your erections wrap themselves around the prostate. As part of the operation, we try to preserve as much of that nerve tissue as possible, which will give you the best chance to maintain the erections. However, there is a balance between that and removing the cancer. Now, if you already have problems with erections, it's unlikely that they will get better after surgery, and in fact, they could get worse. In order to improve people's erections, you will go through a period of rehabilitation, and it can take up to 18 months. We will provide you with a vacuum pump device, which will help improve your erections and improve the blood flow to the penis. This will keep the tissues healthy and move things along. We will also provide you with some medication, which will do the same. Now, if you get to 18 months and things haven't improved, then there are other options to improve the erections. These are medications that are delivered directly to the penis, such as a gel, a tablet, or an injection. If despite these measures you're still experiencing erectile dysfunction, then there is other corrective surgery to try and improve this, and you would be referred to a specialist to discuss this further. So these are the risks associated with surgery. Although they can seem extensive, they are uncommon, and the benefits of having this operation to cure you of your cancer far outweigh those risks, and we know from the evidence that this is a safe and effective procedure. So, what happens after you've had your operation? So, you will return to the hospital after 7 to 10 days, and that will be to have your urethral catheter removed, and the skin clips will be removed at that time. You will then be seen in clinic after 6 to 8 weeks to review how you're recovering from the operation and discuss the results of the specimen that was removed. You will also have a PSA blood test 1 or 2 weeks before that appointment. And these will be the things that we use to measure whether the operation was a success in clearing your cancer. You will then go on to have 3 monthly follow-up with PSA blood test checks at each interval, and you will have your PSA monitored for the rest of your life. The results of the specimen will be discussed at our multidisciplinary team meeting, where the pathologist and the radiologist, as well as the surgeon and oncologist, discuss your results. The specific things we'll be looking at is what type of cancer you have, which will differ from the initial biopsies you had, the stage of your cancer, how far it spread, and whether we feel that the cancer was cleared looking at the margins. This will then determine what happens in terms of your follow-up and any other treatments that may or may not be required.
As discussed with the risk, you are at a higher risk of developing blood clots following your surgery, and therefore you will be given some injections to be administered once a day for 28 days. You will be shown by the staff on the ward how to administer these, and these are the injections that you'll be given. You'll be have to give them daily into your stomach, and you'll be provided with a sharps box to dispose of these afterwards. As well as the injections, there are a couple of things that you can do to try and help minimise the risk of developing blood clots. The first is early mobilisation, so make sure you are trying to mobilise as much as you can comfortably as soon as you are recovered from the surgery. And also you will be initially provided with some compression stockings for your legs, and we advise that you wear these for a set period of time following the surgery, and again the ward staff will provide you with these as necessary. As already mentioned, your wound will be closed with some metal clips. These clips will generally stay in place for 7 to 10 days, and when you attend to see us to have your catheter removed, the clips will be removed at the same time. You will have a dressing on these clips initially, and this dressing can usually be removed within the first 48 hours, and then we advise that you keep the areas clean and dry. You can have showers, but we do advise that you avoid baths where possible, but just make sure the ports stay dry after your shower. It is common to have some slight oozing or bleeding from the wound sites, but there are some signs that you can keep an eye out for if there's any concern of infection. This could be some redness, some inflammation around the port sites, and if you do suspect that there could be any infection, then please seek advice from a medical professional. As already discussed, you will be sent home with a catheter in place, and this will stay in place for approximately 7 to 10 days following your surgery. After that 7 to 10 days, you will attend a designated trial without catheter clinic, where you will see myself or one of my colleagues, and we will remove the catheter and make sure that you are able to pass urine comfortably afterwards. The catheter will look similar to this, and it will be placed down your water pipe, and you will have a bag attached to the end of it to drain the urine. You do not need to worry about the catheter falling out, as there is a balloon at the end of the catheter that will hold the catheter in place, and the balloon will look similar to that inside the catheter. You will be provided with catheter bags and leg bags by the staff on the ward, and they will go through how to manage these prior to you being discharged. If you do have any concerns with your catheters once you are at home, you will be provided with contact details if you have any questions. Once you are at home, you need to make sure that you keep your catheter clean, and we advise that you are cleaning around the catheter site daily to try and reduce the risk of developing any infection. You can continue with your showers whilst you have the catheter in place, and you will be provided with leg straps to keep the catheter secure. You will be provided with the night bags that you can attach that drain larger volumes of urine overnight to allow you to sleep more comfortably with the catheter in place. If at any point your catheter becomes blocked or does stop draining, please seek specialist advice in the form of either your specialist nurse or the emergency department, as this may affect your healing process. You may develop some degree of constipation following your surgery. This could be as a result of the surgery itself, or also the painkillers that you will be provided with. There are some things that you can do to try and help reduce the risk of constipation. The first is making sure you are mobilising as soon as possible. and also you need to ensure that you are drinking a good amount of water. We do encourage you to eat a healthy diet, which includes plenty of fruit and vegetables, and we do also recommend that you only take the painkillers as is necessary. You will be provided with some laxatives to be taken initially following surgery to try and help combat any risk of constipation. As there is a risk of incontinence, we do ask that you perform pelvic floor exercises regularly, and we ask that you start this from the moment that you decide that you want to go down the surgical route. Pelvic floor exercises are done to try and help reduce the leakage. We do know that the leakage can take up to 12 months to resolve. The pelvic floor exercises involve trying to clench your pelvic floor muscle as if you are trying to stop yourself from passing wind or stop yourself from passing urine. For the pelvic floor exercises, we advise that you clench for 5 seconds at a time and do this for 10 times to create 1 repetition. You then do this 5 times a day. You will be provided with some continence pads initially, and if the continence is problematic, then we can refer you to the local continence team to try and help support you with this further. We also have a specialist pelvic floor physiotherapist who can help aid with the recovery if there are any further problems. If after 12 months you are still struggling with your continence, you can be referred by one of our specialist consultants to discuss further management options. As the erectile function can be affected, there will be a period of rehabilitation, and we can assist this with medication management or vacuum pump therapy, and you will be referred to a specialist who will be able to teach you the vacuum pump therapy in more detail. If by 18 months the erectile function has not recovered, then we can refer you to a specialist clinic to discuss further options with a specialist nurse. There are a few things to avoid whilst recovering from your surgery. The first is we tend to advise that you should avoid driving whilst the catheter is in place. This is because it can affect your insurance. We do advise to avoid heavy lifting for the first 6 weeks to try and help stop any complications with your recovery. We also advise to not cycle for the first 4 to 6 weeks. We do advise reducing any caffeine intake, which can include caffeinated drinks such as tea and coffee, which may make your bladder control worse. We do ask that you seek help if you start to feel feverish or unwell, or if you start to have uncontrollable pain. If you start to notice you get some discharge or some redness and inflammation around your wound site, or your catheter tube is not draining, then please contact your specialist nurse or GP or attend the emergency department if required. These things are uncommon but are important to be aware of.